Hello, my name is Dr. Louise Yu. I'm very happy to see you again. Today we are going to talk about the GI tract with Kiki. So Kiki, could you please introduce yourself?
Hello, my name is Kinga Kempinska, but they just call me Kiki. I came from Poland to learn small animal abdominal ultrasound with Dr. Louise. Today we will talk about how to scan gastrointestinal tract. In human medicine, human doctors don't use ultrasound examination for evaluating GI tract because human beings are too big for this kind of examination. But in small animal practice, it's a very useful tool to detect diseases of GI tract.
Yeah, that's true. When I was in Germany and I saw my teacher use ultrasound to check the small animal and the GI tract. And when I come back, there are many students who want to learn from me, and also many companies want me to do lecture to teach them how to do GI tract ultrasound. And also, I'm very lucky. I have many referred cases. The clinical show just vomit or diarrhea. And they did a lot of examination, but they did not find out what the reason why the animal continued with vomit or diarrhea. And then with the ultrasound, I found it could caused by different reasons. Sometimes because they have inflammation of the small intestine, and sometimes it could be some alteration in the stomach, or sometimes could be some problem in the colon. So that means different area could have different problem. And also I sometimes I saw some case. They just come to me in like 3 times. The first time because the dog have foreign body inside, so that's why the dog vomit and have diarrhea. So I tried treat the dog and get the foreign body out, and 1 or 2 months later the dog come back again. So the owner thought it could be foreign body again, but when I do ultrasound, I found a different problem. It is like some small mass on the colon, and also alteration. So you see, with the ultrasound, we can find exactly what's the problem inside, and then we can choose the right treatment plan. So I'm very happy that I can learn ultrasound so at here, and I would like to say thanks to my teacher, who is the boarder of the ESFS, and he's Dr. Koch, and he provides this wonderful machine, and he gave me the opportunity to learn in Germany, and also he gave me the opportunity to teach inside of China, not only to Chinese-speaking students, but also to English-speaking interns. So I'm very happy, and so I'm very great. But I'm also very, very great that I can have this great opportunity to show you guys how to use the ultrasound to do the GI tract. Okay, now I will use this huge animal and draw the anatomy that we are going to talk in a GI tract. First, I will draw some, this is the esophagus. Here's the stomach body, pylorus, duodenum, the wrist part of small intestine, and the ascending colon, transverse colon, descending colon. I will use another corner to mark some anatomy that we will check cardiac area. Fundus, stomach body, pylorus, duodenum. Here is ascending colon, transverse colon, and descending colon. Okay, now I will use this cute dog to show you how to do GI tract ultrasound. So we normally do twice. The first time I will use the no-focus transducer to do the fast systematic scan. So as I showed in the book, like this. So now I will use the no-focus transducer to do the fast scan of the GI tract. So here's stomach, and then I move transducer here and move down and to the right side again, and down to the left side again, and go down and to the right side again, and go down. Then by this way, I finish the fast scan of the GI tract. Okay, as we already mentioned that on the first fast scan, we can find if there's a big mass and if there's a very big change in the abdomen, we can find. But if there's a small change, very tiny change in the layers of the GI tract, or there's a linear foreign body inside, problem we cannot say. So we have to change it to the high-focus transducer. And now in this part, I will show you how to use the high-focus transducer to see the details, different parts of the GI tract, including stomach and the cardio and the fundus and the pylorus, and also duodenum, and also the colon and ascending colon, transversal colon, and descending colon. Now I will use the linear high-focus to show you how to do the GI tract. I will start with the stomach and try to find the cardiac area first. First, I put my probe at here, and then I try to here I saw the stomach body, and then I push my transducer and then try to find the esophagus. The organ between the esophagus and the stomach is the cardio. After I check the cardio area, and then I move the transducer a little bit back and check the body of the stomach, and here is the body of the stomach. After I finish the check the body of the stomach, I'm trying to find the pylorus. So if I try to find the pylorus, I have to push my transducer and to the area where is the duodenal pylorus junction area, and then try to find the pylorus here. The pylorus area is very important each time when we do GI tract ultrasound. Please pay attention to find this area, especially for the animal who vomit. I have many cases that vomit for long time, some even vomit for 3 to 4 years. And then when I do the ultrasound, and I found a big tumor on the pylorus. So there are many disease on the pylorus area, and then it can cause a lot of changes. So it's very important to find this area. After we check the pylorus area, and then you can follow all the pylorus duodenal junction, and then you can find the duodenal area, and we will check the duodenum here This is the image of the duodenum. And we found the duodenal area, and we try to follow the duodenal area, and then try to see the rest of the small intestine, and then we try to find the ascending colon, and try to find the cross colon, and descending colon. For the colon is also very important. We have to do ultrasound examination. There are two ways to find the colon. One way is that I just showed, to find the duodenum and follow the small intestine, and then try to find the ascending colon, transverse colon, and descending colon. This is one way. The another way is much easier. We find the urinary bladder, and then find the colon, and then along the descending colon, and then follow. I found the transverse colon, and I follow here, and then find the ascending colon. Okay, this is the study video that show you how to find the different part of the GI tract. So what do you think about?
I think it's really useful. Often it happens that owners of pets come and they are convinced, for example, that the dog swallows some foreign body, or they think they know the reason of symptoms like vomiting or diarrhea, but ultrasound shows us totally different results, usually some ulceration or mass. So diagnosis is totally different.
Yeah, that's true. So I also use ultrasound to monitor how the foreign body move inside, because sometimes the dog eats foreign body. But the owner do not want us to perform surgery immediately. They prefer to wait to see if the dog can throw up, or the foreign body can pass through the GI tract. So I always use ultrasound to monitor how the body move inside. If it blocked there, I have to decide to do surgery immediately. If not, I would like to wait in 24 or 48 hours to see how it moved down. And also sometimes I will even use acupuncture to help the contraction of the GI tract, to help the foreign body move inside. That is very interesting and amazing, and I really like that very much. So I hope you can learn how to check different parts of the GI tract, and then I hope I hope you will find it is useful in the practice. Okay, thank you.
Bye-bye.
Bye-bye.